Hello guys, welcome back to ultrasound teaching videos with Dr. Arshid Nadeem Awan. Hope you are all okay. You're all enjoying your life. You're all enjoying practicing ultrasound. You're all enjoying watching my videos as well. So in the previous lecture, I have discussed about the cervical abnormalities. Today, I'm going to give you a brief descriptions of the abnormalities of the endometrium, and then separately, I will upload separate videos for every single abnormalities of the cervix. But this is in a bird's eye view. We are going to look for how many pathologies you can come across so far the endometrium is concerned. First of all, for the endometrium analysis, transvaginal ultrasound is recommended because of higher resolution, because of clarity. So that's for transvaginal scan is recommended for the endometrial pathology. The second thing is, so far the myometrial endometrial interface is concerned, it is very important area where lot of pathology you can observe, but on the transabdominal ultrasound it is quite impossible to have a look for the endometrio myometrial interface, so it is better to go for the transvaginal scan. So far the endometrium sonographic appearances are concerned, mind you that it depends upon the menstrual phases. As I mentioned earlier, there are three phases: proliferative phase. So the appearance of the endometrium will be different in a proliferative phase. If endometrium is in secretory phase, so again the ultrasonic appearances would be different, and in the menstrual phase. Beside this is appearances depend upon hormonal status as well, level of the estrogen and progesterone. Third thing, it's also depend upon the menstruation and the menopausal status. So again, the differentiation on the basis of the ultrasound, it would need to evaluate whether the patient is in menopausal status or which phase of the menstrual cycle is going on. As far as the thickening is concerned, again, I would say that it depends upon the menstrual status, menstrual cycle, menstrual phase, hormonal status. Beside this, menopausal status or menstrual phases, which actually need a clear history. So, therefore, before going to come to the diagnosis or come to the conclusion, you should have to have all these information available. As far as the pathologies of the endometriums are concerned, there are a lot many pathologies, including endometrial polyps. So you may come across endometrial polyps, which are very important to look for. Endometrial hyperplasia. This is another condition in which the patient will complain profuse discharge, profuse bleeding, menorrhagia or metrorrhagia. So endometrial polyps, you must keep in mind. Endometrial hyperplasia, you should look for when the patient is complaining about the heavy periods. And beside this, endometrial carcinoma. So these are the three entities in which I will upload different videos, but this is generally, you should have an idea which type of abnormalities you may come across when you are scanning when you are scanning the patients for the endometrial abnormalities. As I mentioned, that there are two types of menstrual abnormalities: menorrhagia or metrorrhagia. Menorrhagia, when there is excessive bleeding within the menstrual period. If a lady she has menstrual periods for 4 days, and within these 4 days she bleeds. But within these 4 days, if the bleeding is excessive and heavy, that is called as menorrhagia. But metrorrhagia is term applied for that lady will be bleeding either in on 10 days or 11 days or 15 days or 18 days, regardless of her menstrual cycle. If she bleeds, so that would be called as menorrhagia. So there are certain abnormalities for the menorrhagia and metrorrhagia you can distinguish on the ultrasound imaging. Menorrhagia and metrorrhagia may also be caused by certain other areas, like sometimes there is vulval or vaginal abnormalities, like if there is any infection or there is any laceration or carcinoma of either vulva or vagina, so there will be either menorrhagia or metrorrhagia. Beside, if there is any cervical abnormalities, including cervical polyps or cervical carcinoma or cervical leiomyoma. So this may give rise to menorrhagia or metrorrhagia. If there is any endometrial abnormalities, including endometrial polyps or endometrial hyperplasia or endometrial cancer, so there will be again bleeding. If there is fallopian tubes are involved, like in case of self-angiitis or any other infectious or pelvic inflammatory disease, sometime there is menorrhagia or metrorrhagia spectrum. If there is any abnormality related to ovaries, secondary to ovarian abnormalities like increase or excess estrogenic hormones or estrogenic hormonal tumors, or there may be sometime functional follicle. Functional follicles may also give rise to bleeding. So far the treatment patterns are concerned, you have or diagnoses are concerned. For the diagnostic purpose, you have a self-angiohysterography. So self-angiohysterography is one of the procedure you can detect the diagnosis, or non-directional biopsy. You can take the biopsy and then find it on the histopathology. So histology will give you the clear view or clear picture of the diagnosis. Or sometime hysteroscopy, through the stereoscope you can take directional biopsy as well, or excision is the last chance, last option. You can go for that for the diagnostic purpose. So these are all the areas which I have covered in this imaging. So far all these area and slide pathologies are concerned, I will first show you certain images. In the following slides you will look for all these images, but these are not complete pathological processes. I will upload separate videos for all of these issues, but in general, to have a clear idea roughly what are the abnormalities of the endometrium and how you will pick this on the ultrasound imaging. So let's start watching all these images. On this transvaginal scan, you can appreciate the uterus, and within the uterus, that is the endometrial canal. Within the endometrial canal, there are multiple cystic lesions. Actually, this patient was on tamoxifen, and that is tamoxifen related changes on transvaginal scan, especially in the endometrium, and that changes occurs because of endometrial hyperplasia. So this happens, patient had already endometrial hyperplasia, patient started taking tamoxifen, and after tamoxifen hyperplasia appears in that condition. So this is likely possibility the patient who's taking tamoxifen. Therefore in the patient who are treating or treated with breast cancer drugs, you must always take care of endometrial abnormalities, because endometrial hyperplasia, especially in this cystic form, there will be thick cystic endometrium. That would be because of hyperplasia, and that is a reaction to the tamoxifen. So therefore you might have observed that many a time you will receive the patient who is already on tamoxifen and taking the drugs for other drugs for the breast cancers. We usually recommend the transvaginal scan for looking for the endometrial changes, either endometrial hyperplasia or endometrial polyposis. This another slide also explains tamoxifen related changes in the endometrium. In that case, this tamoxifen related changes appears as a large polyp. So here you can observe endometrial cavity is distended, and this is actually a large polyp with central cystic changes. So this thick cystic changes is within the polyp. So this is again, as I mentioned you, this is related to tamoxifen changes. Sometime, like the patient if is in is in the reproductive phase, so this could have been like high datidiform mole, but that is not the high datidiform mole, because you have to look for the age and the patient previous history, and the patient would be taking certain cancer related drugs, especially tamoxifen. So when the patient is on tamoxifen, it is better to do the transvaginal scan. When you do the transvaginal scan, always focus on the endometrial changes. So there will be either endometrial hyperplasia or maybe chance of development of the cystic endometrial polyps. This is another transvaginal scan of 52 years old with a history of post-menopausal vaginal bleeding. This endometrium is 16 millimeter thick, and you can see there are complex endometrial hyperplasia, and you can appreciate numerous small cystic spaces diffusely within the endometrial parenchyma. So this is basically complex endometrial hyperplasia. So this may appear in that condition as well. As I mentioned in the start that I will separately do the video for the endometrial abnormalities, endometrial hyperplasia, different patterns of the endometrial hyperplasia, how it will look and how we will appreciate, how we will write the report, what the next modality would be, and how we will manage that case ultrasonographically. So just keep watching. This was just an example of introductory video for the endometrial abnormalities. Now here this image explains a very common abnormality, and that is endometrial polyps. In the cervical region, I have also discussed the cervical polyp, and sometime if endometrial polyps gets large enough to spill out from the endometrial cavity into the cervical cavity, this likely happens. So here this is clearly mentioned that these are endometrial polyp, but here you can see the one thing which is a great advantage, that is the fluid. If you have fluid within, if you see fluid within the endometrial cavity, it will help to appreciate small or large polyps within the endometrial cavity. Again, I will explain all these things at length with the topic of endometrial polyps separately. So any confusion relating to the endometrial polyp and its different positions and its different diagnostic tool, we will discuss all these things at length. But this was just an example of the endometrial abnormality that you may bump into endometrial polyps while doing transvaginal scan. It is just for your understanding, that is endometrial cancer. Endometrial cancer is a very important topic. It needs a separate video and different images to understand the endometrial cancers, but in short, just for an introduction, this slide has been added. You can appreciate how big this endometrial thickening is. So you will never see this in normal beings, so until there is any pathological processes. So this is what endometrium cancer look like. Not all the cancers, there are different varieties of the endometrial cancer, which I will explain in the next or separate video. But for an example, if you come across with such thickened endometrium, always consider endometrial cancer. Before going to diagnose the cancer, you must put Doppler signal on it and look for the vascularity. If it is vascular and if it is thick, so consider this could be endometrial cancer. Now this is clear image for you. This is again endometrial cancer. Again the endometrium was very much thick. It was echogenic. Sometimes it may appear hypoechoic as well, or heterogeneous, in either case. But so far the vascularity is concerned, you can appreciate hypervascular endometrium. So this hypervascularity will start ringing the bells in your mind that this could be neoplastic activity, especially malignant. So this shows that this endometrium has malignant potential. So therefore, always measure the endometrium, look for the patient menstrual cycle, because due to the cyclic activity endometrium thickness changes, and especially after menopause. After menopause, endometrial cancer is very common. those patients who are on HRT, hormonal replacement treatment, they are also prone to the endometrial cancers. So in all these three conditions, you must look for the endometrium very carefully. Always go for the transvaginal scan, take the measurement, put the Doppler signal on, look for the vascularity, and then mention it on your report. Yes, friends, we have already discussed about briefly about the endometrial abnormalities, what you may see while you are scanning, how you will appreciate all these abnormalities, if it is endometrial thickening or endometrial polyp, or is a premenopausal or postmenopausal or during the menstruation, how all these abnormalities will look like. So I hope this will help you to certain extent to understand how you can appreciate all these endometrial abnormalities. But mind you, I have also clarified here that for each single topic I will upload separate videos so that you could have all these abnormal pathological processes at length, and you can understand what the pathological processes are and how you will pick the all these pathological processes on the ultrasound imaging. If you have any query, if you have any question, just drop me a message and I will get back to you. And thank you very much for your feedback. I'm regularly receiving your feedback. I'm really enjoying all these working for you, and you must also be enjoying watching my videos. Keep share my videos, watching my videos, and subscribe my videos. I will come up with the next videos. Till then, take great care of yourself. Bye bye.